Good morning and welcome to Politico's Healthcare Summit. Thank you for joining us. It's so lovely to see so many people here with us this morning. My name's Helen Collis. I'm the health editor at Politico. Well, what a rollercoaster couple of weeks we've just had in Brussels, let alone the past year. We now have a new European Parliament with more MEPs from the extreme right, left in many decades. And this new Parliament has just completed its first big task, completing the 26 hearings for Ursula von der Leyen's new College of Commissioners. At Politico, we didn't just do one rolling live blog to cover the event. No, because we're Politico, we did 26 live blogs, concurrently and back-to-back, absorbing the entire Brussels newsroom in the process, to deliver fun and hopefully newsy insight from the hearings and to keep you up to speed and entertained in the process. We hope we made the, some might say, rather dull and potentially tortuous hearings a bit more enjoyable for you all. And hopefully we'll be able to deliver you a fun and entertaining experience today and over the next 2 days. We've got an incredible lineup of speakers for you today and tomorrow, including the incumbent Health Commissioner, 7 MEPs, 3 health ministers, 3 agency leaders, and many more. But ultimately, we're here to delve into some of the biggest challenges in health policy that Europe is facing, and importantly, what Europe can and should do to overcome these challenges. And as we enter the winter season, one of the most pressing topics, even for some of you in this room, will be the chronic drug shortages that worsen at this time of year. We'll also delve into the pharmaceutical legislation, Europe's new tilt towards competitiveness across all of the Commissioner's portfolios, and whether the EU can solve the medical devices shortages as well as healthcare staff shortages that it's facing, all of which are causing huge added burdens to clinicians and patients alike. But first, we're going to take stock of where things currently stand in Europe in ongoing EU health policy, the biggest challenges facing the more politically polarised European Parliament, how countries and their health services are attempting to rebuild after the pandemic, and we'll also look at the progress and challenges in implementing the Beating Cancer Plan. Before we kick off, I'd like to thank our partners for making this summit possible. Our leading partners are FPA and Sanofi. Our presenting partners are Daiichi Sankyo, Gilead, Johnson & Johnson, MSD, and the PPTA, and our networking partner is Intuitive. A few housekeeping rules first. We love a good debate, so if you hear something you'd like to share on social media, please do so using the hashtag #PoliticoHealthcare. Some sessions will include a Q&A, and the moderator will make that clear for you. If you would like to ask a question, please do so as a question and not a statement, and indicate who you are and where you are from. For those of you who are joining us in the room, we'd also like to invite you to a standing yoga session at lunchtime at 1:20 in the main networking room. We're now going to open our summit with an interview with European Health Commissioner Stella Kyriakides. Commissioner Kyriakides is joining us in what is likely to be her last ever interview in the role for her this term, which could be coming to an end in a matter of days. She took up the Health Commissioner job in December 2019, just as Chinese hospitals were reporting concerning numbers of an unknown respiratory virus. Europe's subsequent response to the COVID-19 pandemic became central to European Commissioner Kyriakides' work at the Europe Health Directorate, and this work went on to underpin arguably one of her biggest projects, the establishment of the European Health Union. That brought together several pieces of new legislation and strengthened existing laws to better prepare countries for another health crisis. But the ambition goes beyond that. Last year, in our closing interview at this summit with Commissioner Kyriakides, she told us that to build on the health union, all European citizens should have access to all medicines when they need them, regardless of where they live. We're going to dig into this and much more now. Commissioner Kyriakides, please come and join me at the stage. Hi. Thank you. Welcome. Thank you for joining us again at our summit.
Thank you for the invitation.
And your last in your role as Commissioner. It's been a significant mandate for EU health policy by any measure, arguably. Numerous pieces of new legislation have passed, such as the Health Technology Assessment, the European Health Data Space. The pandemic has been and gone, and we saw the health budget grow significantly. We saw the launch of the European Health Union, which saw HERA launch as well. But there have been many other firsts. The first fully budgeted strategy to fight cancer, as well as the first European approach to fighting mental health diseases as well. Commissioner, of all of this work, is there one project for you that particularly stands out that you're most proud of?
I think, as you said, there were many firsts. And the first was the unprecedented health crisis we faced with the COVID-19 pandemic. And that really set the stage for what was to follow. I don't like to say that out of crisis comes opportunity, because with COVID we lost so many lives. But the truth is that we also had the opportunity to show what strength and solidarity can do when we work together in the European Union, and then build on to what is now a European Health Union. That, I would say, together with the first standalone, well-funded program for health, EU for Health, is what set the stage for what was to follow. When we began our mandate in 2019, we had a health budget of about 400 million. And with EU for Health, we had a budget that went up to 5 billion. So that was the change in health. And I think it is that paradigm shift which, for myself, stands out, looking back for the last 5 years.
That is a huge jump in the budget. And I know that throughout that time, I mean, it's not all been plain sailing. There's obviously been a huge amount of work throughout the pandemic, but also some other areas which have been potentially quite challenging. I know that the mental health approach was very much welcomed, but there were concerns that it lacked the funding and some of the targets to implement it. Medical devices regulation, we know the implementation has been pushed back partly because of the pandemic, but because of other problems and ongoing issues with this legislation, which are now very much to the fore again and asked to be revised and resolved. And there were concerns about plans to tackle chronic diseases by implementing prevention measures and pushing forwards on more ambitious smoking targets or smoke-free environments, and making people more aware of what goes into an alcoholic drink by putting a labelling thing on the front of every bottle in the cancer plan. Obviously, these are things that are ongoing as well. What, in your view, have been some of the biggest challenges facing you as Commissioner in delivering some of these things?
I don't believe that you can ever have smooth sailing with health. What we've seen with the pandemic is that the realities change overnight. And this realization for member states, for institutions, for European citizens, is that health is a political priority and needs to remain a political priority. And for ourselves, many of the topics that you raised, yes, we face challenges with medical devices, and that's why we extended the transition phase, and we may need to relook at the whole framework in order to make sure that we deliver safe medical devices for patients. Mental health was another challenge. It was not something that was even discussed before. And then with the pandemic, these challenges suddenly, that were always there, it was not a new challenge that member states faced or that citizens and patients faced. It suddenly rose to the surface. And we now have the first comprehensive strategy. Is that enough? Definitely we need to do much more, but at least we're talking about it. And this, I think, as part of a European Health Union, as part of a European Health Union that delivers for citizens and patients, is the way forward. We have 2 agencies, ECDC and DMA, that did outstanding work during the pandemic. But if we look back and be honest with ourselves, they did a lot of work which was really almost ad hoc, trying to improvise to deal with this unprecedented crisis. We strengthened their mandates. This is about building a strong health security in the European Union. So a great deal has changed. The European Health Union is not an abstract concept. It is made up of very specific pillars, which are at the point of being implemented. A great deal remains to be done, and I am confident that we will be moving in this direction, because health is there and needs to be there at the top of the political agenda. You cannot have, and we saw it with COVID, you cannot have health societies and economies function smoothly if you don't have health. So I think this is a realization that everybody is taking forward now.
I'm going to come back to the political agenda that you mentioned earlier, but I want to dig a bit more into one of the biggest problems that EU health systems are facing, which is surging rates of chronic diseases. And the Beating Cancer Plan was really celebrated as an ambitious strategy to help countries deal with that, with a sizable budget to implement it. I wonder if you can update us on a few of those things. So one of those milestones was for every member state to have at least one cancer centre in them by 2025. Is Europe on track to meet that?
We're on track to meet that. As you know, the cancer plan is one of the pillars that is very close to my heart. I'm someone with lived cancer experience. It was a priority in my mission letter, and to have the opportunity to work at the European level to implement a cancer plan that is going to benefit the lives of citizens, of cancer patients and their families, for myself was a huge privilege. One of the initiatives that is ongoing in this plan, which has unprecedented funding of 4 billion euro, is the building up of a network of comprehensive cancer centers. Why? Because the plan is based on equity. We need to ensure that patients and cancer patients, no matter where they live in the EU, have access to quality services. And by building up a network of comprehensive cancer centers that will be accredited, we are making sure that patients will all have access to this level of care. On the opposite side of the coin, if I may say, you don't know what you need to address in 27 member states unless you know the weaknesses. So for the first time, we put forward an inequalities register, in which we pinpoint the weaknesses in each member state. We do that in order to know what we need to target. We've updated cancer screening recommendations. I was quite, I must say, surprised to see that these hadn't been updated in Council for 19 years. Medicine has changed so much, and what we do for early diagnosis. We updated them. This was a huge step. And we've put 3 new cancer sites. Is it enough? No, because when you look at screening across the EU, not all member states have the same level of access to screening. So
Sorry about that, I'm not sure that was for us.
Tells me I need to be briefer in my answers. I visited all member states, and I visited oncology hospitals in all member states. Because by being there on the ground, speaking to patients, to families, to doctors, you get a good idea. Do they know this plan exists? Do they believe in it? What do they feel we should be focusing on? How can I work with the ministers? So it is an important part of our European Health Union, but it also feeds into everything else. And I'd like to, when we speak about the European Health Union, if I may, see it as a package. Unless we change access to medicines and shortages, we're not going to benefit cancer patients or those with rare diseases. Unless we're able to deal with mental health, we're not going to support cancer patients. So the pillars of the European Health Union are not standalone pillars, but they're pillars that actually come together to give a better life for patients in the European Health Union.
Lovely, thank you. And one other element of the cancer plan before we change topic was alcohol labelling. I was wondering if you were able to update us on that. We understand from our colleagues that it's been shelved entirely. Is that true, and will we see it move forwards in the next mandate, do you know?
I cannot give a timeline, but yes, work is ongoing for that. It is a very important part of what we're doing in terms of prevention, because one of the significant pillars of the cancer plan is prevention. What we do with alcohol labeling, what we do with our nutrition, our lifestyles are all part of the pillar of the cancer plan, which is based on prevention. And also, what we haven't mentioned with the cancer plan, an initiative that I would have liked to see completed, and we're not there yet, but we have made a progress, is the right to be forgotten. The unacceptable discrimination that those with lived cancer experience have in accessing financial services. We've brought it to the European level. There were 6 countries that had regulated this. Now there are 13 member states, but I believe that it is something that we need to work on so that patients in all member states are not discriminated against after going through cancer.
Thank you. Back to your European Health Union legacy, if you like. It started out as a project to boost the bloc's health crisis preparedness and resiliency. And last year you told us that equalising access to medicines for all patients throughout Europe should be part of the Health Union as well. DG Santé, in its proposal for the pharmaceutical legislation, sought to improve access to medicines for patients by offering companies a 2-year monopoly right incentive for launching in all countries. We now have a more right-leaning European Parliament and a real drive for competitiveness throughout the portfolios of the new commissioners. Are you concerned that these shifts might do away with the Directorate's plan to make the monopoly rights conditional upon market access?
When we put forward the reform for the pharmaceutical legislation, which is 19 years, took 19 years coming, I said that it should be based on the 3 A's, on access, affordability, and availability of medicines. We are trying to create a single union of medicines. It is imperative in health, when we speak about health, and this has always been something that I believe in, is that we need to have equity. Equity is central. Health is a human right. And in this sense, access to medicines when patients need them, no matter where they live in the EU, is crucial. The reality is now that you have medicines that are available in some member states in the EU that citizens and patients in other member states may wait months or even years if they ever have them. So we needed to bring about change. We have medicine shortages. That was on the agenda before the pandemic. That was in my first Health Council in 2019. So we put forward a proposal that is not an either-or. I do not believe that by ensuring that we have the 3 A's, we do not also have competitiveness and innovation. We put forward a balanced proposal, and I'm very confident that the co-legislators will be able to see it in that way. You need an innovative, competitive pharmaceutical industry in Europe in order for us to be able to have a strong European Health Union. And at the same time, we put forward incentives, earlier access in the market of generics, and other proposals in our reform to have the two together. So it's not an either-or, and I'm confident that this will move forward because ultimately we're all looking at putting the patient in the center. I'll stop before the bell rings again.
And also talking about access to medicines, access to critical medicines, largely generic medicines, which have been around for donkey's years. We have chronic shortages of many types of medicines at the moment. And a year ago, in fact, in our last summit, the Commission announced a raft of measures to prevent shortages, including the establishment of the Critical Medicines Alliance, which is now up and running. We were told earlier this year that the first report from that alliance would come out with recommendations in October, which has been and gone. Can you tell us where things stand? We haven't had the first recommendations. What are the biggest challenges here?
Medicine shortages is a huge issue. So first of all, we started by putting forward the first critical medicines list. We needed to identify which these medicines are that we face the shortages. From that on, we moved to the Critical Medicines Alliance, which was the first time we brought together all stakeholders and industry and member states. Yes, you're right, the report hasn't come out. We're expecting it to come out shortly, I think, at the end of the year. I cannot give you a timeline on that. But as you've seen from the mission letter for President von der Leyen for the next Commissioner of Health, we're now moving into a Critical Medicines Act. We need to address the issue of shortages. A great deal has changed already. I want to mention here that our new authority, HERA, which we put together, works on this, and this has significantly given us information. And for the first time, we put forward a voluntary solidarity mechanism, which allows member states, in exceptional circumstances, if they're facing shortages in one critical medicine, to work together with another member state. This did not exist before. So when talking about health, I always think it would be wrong to say, to speak about only what we've achieved. We have achieved a great deal, but it never stops. We need to go on moving in the direction that we have set out, because ultimately this is what European citizens demand from us, and this is what we should be delivering.
Is the solidarity mechanism working in your view? Because we now have, since then, many countries have gone and implemented their own mandated stockpiles of certain medicines with high fines if companies don't deliver on those.
So we've seen it work. It's already been used in one or two instances, but it's not, when we're dealing with issues to do with medicine shortages, access and availability, and the pharmaceutical reform, one must look at all the proposals that have been put forward as a toolbox. For things to change, we need this toolbox to all come together. For example, you need to simplify the regulatory mechanisms. You need to make sure that generics reach the shelves earlier. You need to make sure that we have approval from the EMA in a shorter timeline than what we have had in the past few years. We did it during a pandemic. We were able during the pandemic to change the realities of how we worked. Why do we need this at the time of crisis? This needs to be the way we work at all times in a European Union of Health.
Mm-hmm. Mm-hmm. And among the other commitments from the Commission for Drug Shortages last year was to launch a preparatory study to assess the economic impact of the Critical Medicines Act by the end of last year. Thus, this would pave the way for an impact assessment, which is the first step for the new legislation. Can you update us on that? Has it been done? How far off are we?
That's ongoing, and we're collecting the information. I believe that the next Commission will be taking it forward, because it's very clear that the Critical Medicines Act is now the next step from the Critical Medicines Alliance. This has all been work that's ongoing for the last 2 years. And I'm confident that we'll be able to, with the discussion in the Parliament of the reform and then the Member States, to actually put together this toolbox that we need.
And how long would an impact assessment normally take? I know Oliver Varhelyi, in his Commissioner hearing, said he would deliver the text for a proposal on a Critical Medicines Act within 100 days. Is that doable?
I believe that from the moment this commitment has been made, of course it's doable. Impact assessments are important because you need to know what you're stepping out to do. And I know that sometimes for those watching and they hear the word impact assessment, it's as if we're delaying things. But we need to be building our proposals on solid science to know where we're going in order to make sure that they're going to stand up to the test of time. And this has always been very important in our mandate, to really have evidence-based proposals and position ourselves in a way that we can then really support what we've put forward. So I believe that the issue to do with pharmaceuticals is one of the crucial issues that we are facing in the European Health Union, but it cannot be seen separately to what else we need to do. For example, digitalization in health, the proposal of the European Health Data Space, how that feeds into the pharmaceutical reform. This is why I say that the European Health Union is not 6 standalone pillars, but they're interconnected and horizontal.
Mm-hmm, mm-hmm. I want to look to the future a little bit now. We're imminently expecting a decision on Hungary's choice for Commissioner. Oliver Varhelyi, a lawyer and a former diplomat, and whether or not he'll be approved possibly tomorrow. As a psychologist, you are the second medically trained and qualified person to sit in the role as Health Commissioner after Vytenis Andriukaitis, who I think is here with us in the room, who is a surgeon who went before you. You have already spoken about going out into the community and meeting with cancer practitioners and people in hospitals. I wonder, what do you think if your personal experience in the health sector has helped you in this role, and if you worry that the next commissioner might lack this insight?
I can speak of my personal experience. Whatever we do with health, we need to keep one thing in mind. And I think that this is for anyone sitting, holding the position of Health Commissioner, that patients need to be in the center. That we're doing what is important for European citizens, and we need to keep patients in the center. And I'm sure that this is exactly the way forward. I have seen the mission letter that President von der Leyen has prepared for the incoming commissioner, and it is exactly in that philosophy. We're building on what we have started out to do. And I remember very vividly in the first 2 or 3 months of the pandemic, and we were all holding numerous calls in front of a screen. We stopped meeting like this. This would have been impossible. And so many stakeholders were saying, where is Europe at this time? Where is Europe at a time when we're facing this health crisis, when people are losing their lives, when we don't know what the next day holds for us? There was so much fear. And I remember then thinking, we cannot allow European citizens to feel this way about health again. And this is something that we have all lived experience with. And it's something that we take forward, but in a positive way, in a way of being creative, of not looking back and feeling a trauma out of it. We lost many lives, but we need to build for the future, for the European citizens.
And building on that, obviously you have launched the European Health Union under your mandate. The next commissioner has been tasked with completing the Health Union in their mission letters. It sounds very much like you're just getting started. What are your thoughts on the idea of the project wrapping up within the next 5 years?
I don't believe that you wrap up health. I think that completing the European Health Union is exactly that there are many, many projects which are now in the process of being implemented, and we need to go on pushing in that direction. And I'm sure that as the next 5 years progress, new issues and new projects will be developed. We're at the beginning of a path of this change in the paradigm shift, which has put health at the top of the political priority, and it is going to remain there moving forward, because health is part of horizontally all the policies that we deal with. And this is also very evident in the last 5 years in working with my fellow colleagues in the college. The Europe's Beating Cancer Plan, this is not just health. We were, I think, 10 commissioners working towards it. The digital COVID certificate that we all take for granted was always there. It was Commissioner Reinders, Commissioner Breton, myself. We worked together as a team to put it together. And that is how you need to look at health. You work holistically and horizontally.
I'm conscious of time, but we also have, you've touched on it before, but we also have a very more politically divergent and polarised parliament at the moment. Are you concerned that more right-leaning groups might significantly cut not only the European health budget, but their national budgets to public health as well?
European health values are there, they're enshrined. And I believe that as a Commission, we have very clear values and clear ways forward in how we see health and how we deal with health. And that will remain unchanged. I'm also a person that believes in building bridges and in fighting disinformation and misinformation and finding ways to work across the board. I've been to Parliament since the elections at the sessions. I've put forward difficult topics, and I've found out that you can, if you go there with solid proposals, keeping patients in the center, you can bring everyone on board.
Thank you so much. I have now just some very quick fire rapid questions, as it is our last chance to ask these of you. Cats or dogs?
Cats and dogs.
Cats or dogs? Are you a cat person or a dog person?
I'm an animal welfare person and a cat and dog person. I'm a pet person. I'm very happy with this. It's gone forward. It's being discussed.
No, this is literally just a quick fire.
No,
do you prefer cats or dogs?
I'm so glad that you raised it, because everybody said that we couldn't do this for pets. And I myself, I go in there thinking that we need to change something, let's find a way. And we found a parliament that was very willing to support, and the member states willing to come on board. So cats and dogs are going to be well protected.
My next question is Cyprus or Brussels?
Going back to Cyprus, hopefully visiting Brussels, but definitely not retiring.
And do you prefer autumn or spring?
Summer.
Summer, there we go. Thank you so much for joining us.
Thank you so much for having me.
I'm sure you will be missed by many people in Brussels, in the Health Bubble and in the capitals for all your work you've done and the advocacy, especially in cancer.
May I thank you and thank Politico for this opportunity, possibly my last interview, and really thank you for allowing me to share some thoughts.
And we wish you all the best in your next endeavours. Thank you.